A lot of people know the content of what goes into the NCMHCE, but what they struggle with is how to apply it the way this test wants. So today we're going to do a narrative together, and I'm going to show you exactly what's going through my head when I'm doing a narrative so that you can learn how to best navigate these questions. I'm BC, I'm a licensed therapist, and I help people pass the NCMHCE. In my one-to-one tutoring sessions with people, the biggest thing we focus on is how to navigate the questions, because it can be really overwhelming and it's not always like real life therapy. Today's narrative is going to be pulled from the official National Clinical Mental Health Counseling Examination Handbook, and we're going to be using my NCMHCE framework guide so that you can see how to apply your knowledge in a way that works for this test. So let's jump in. So as I mentioned before, we will be doing the sample narrative that is in the official handbook from the NCMHCE. This is for the current version. The exam will be changing in the summer of 2027. And so if you're watching this in the future, make sure to check for the new version, but as of right now, this is the version that is current for 2026. An NCMHCE exam has 11 narratives. A narrative is one client and 3 sessions with each of those clients. Today, we will just be doing one narrative. First, I'm going to show you guys what to pay extra attention to when we're reading a narrative. So I'll highlight, do some colors, underline, things like that so you can visually see what's worth focusing on. Then I am going to clean the screen. I will read everything out loud and we will start answering the questions. So here is our narrative. We are in part 1. Up here at the top, we have the demographics. So when we are reading these, there are 4 things I want you to pay extra attention to. The first one is the counseling setting. This can also be called a location of therapy. If you are doing practice narratives on counselingexam.com, which is my preferred website. So counseling setting, this can be helpful for some of the ethical questions, especially in terms of confidentiality, because different settings may have their own things to keep in mind. This one is an agency. With agency and community center narratives, we want to be looking to see, is the client court ordered? Do they have a probation officer? Because if that's the case, it often is with the agency and the community center narratives, we want to be looking to see if we have to communicate with anybody else already. When it is the case, we are only sharing information that is directly related to the case. So if the client is here for substance use, but during our work in therapy, we realize that they have significant childhood trauma, we don't share the childhood trauma with the probation officer. We share the things related to the substance use directly. With agencies and community centers, we also want to look to see if there is a psychiatrist on the facility that is part of the treatment team. If there is, then we already have permission to collaborate with the psychiatrist without needing a separate release of information form. Second thing to be looking for is type of counseling. This can also be called the modality. Individual therapy is the most common one, but you might also see family therapy, couples therapy, and group therapy. When the client is a minor, we want to pay extra attention to the modality or the types of counseling, because that's when we'll see it fluctuate between family therapy and individual therapy. But for this one, the client is an adult, so individual therapy is all we need to be thinking about. The third thing to keep in mind is the provisional diagnosis. I like to think of this as our starting point. We need to read the narrative ourselves to make sure that the symptoms and behaviors that the client is presenting with fit the provisional, because sometimes they may ask us, how did we know that this was the correct diagnosis? Other times they may ask us, why did we pick this instead of a differential that's very similar? Other times they may ask for an additional diagnosis, and in some very rare occasions, they will say, provisional diagnosis is incorrect. What should it be instead? So think of your provisional as your starting point, but make sure to check the symptoms yourself. And then fourth is the presenting problem, which can also be called the clinical issues. Previously, this presenting problem used to be higher up in the demographics, and it was just a short little sentence. Now we have more to read with the presenting problem. I like to look at the presenting problem or the clinical issues to help get an idea of what our main focus is. So when we have a client that has a lot going on, with the exception of safety, we want to refer back to the presenting problem. When we're reading the narrative, there are 5 things that we are looking for. When we're just in part 1, there's really only 3 we can look for. The first one is measurable, and we will do that in red. I'm just going to read a little bit of the presenting problem so you can see what I'm referring to when I say measurable. Measurable refers to anything that we can count. So frequency, lengths of time, amount, durations, ages, all of that will help speak to the severity of what's going on for the client. Now I'm going to start reading these first 2 paragraphs or so and show you some of what I mean by that. You're a licensed mental health counselor working in a private practice setting. During the initial counseling session, a 35-year-old divorced female, mother of 2 children, aged 10 and 12, says she has come for services because I'm in a rut and cannot find a way out. I feel hopeless and I'm not sure what to do with my life. Your client says the feelings of hopelessness began 6 months ago, and the session with you is her first attempt at counseling. I want to feel as confident and happy as I was when I first met my ex-husband. All right, so that's kind of just a visual representation of some of the measurable. Next, we are also looking to see symptoms and behaviors. We'll do it in blue. So with the symptoms and behaviors, we're looking to make sure that the symptoms fit that provisional diagnosis. So for this client, the provisional is major depressive disorder, single episode moderate with anxious distress. We'll be looking at the symptoms to see if that fits. So going back to that same first paragraph I just read, you're a licensed mental health counselor working in a private practice setting. During the initial counseling session, a 35-year-old divorced female, mother of 2 children, aged 10 and 12, says she has come to services because I am in a rut and cannot find a way out. I feel hopeless and I'm not sure what to do with my life. Your client says the feelings of hopelessness began 6 months ago, and the session with you is her first attempt at counseling. I want to feel as confident and happy as I was when I first met my ex-husband. So those are some of the symptoms and behaviors. Next, we're going to look to see who or what else besides the client is being impacted. And we'll do that in green. This can refer to friends, family, work, school, and it will all speak to the functioning level of what's going on for the client. When the client has a diagnosis that is a mood disorder, a substance use disorder, a personality disorder, or a behavior disorder, we tend to see a widespread impact in the people and things around that client. And the test likes to ask questions about it. So going back to this first paragraph, you're a licensed mental health counselor working in a private practice setting. During the initial counseling session, a 35-year-old divorced female, mother of 2 children, she has come for services because I'm in a rut and cannot find a way out. I feel hopeless and I'm not sure what to do with my life. Your client says the feelings of hopelessness began 6 months ago, and the session with you is her first attempt at counseling. I want to feel as confident and as happy as I was when I first met my ex-husband. Because there is only one piece here, I'm going to go to the next paragraph. I was working full-time as a caseworker and taking classes to be a nurse. She's currently unemployed, but previously worked from home doing billing for a major insurance carrier. The client appears tearful and expresses that she has felt like a failure since moving back in with her mother a year ago. My kids are often in trouble at school, and it got to a point where I couldn't handle it on my own, so I had to ask my mom for help. The client reports feeling sad and anxious since her divorce from her husband 3 years ago. He left me for a younger woman, and I don't know how I will make it without a spouse. She feels sad, empty, and lonely most days. Disclosing, I woke up feeling sad. I can't remember the last time I enjoyed something. Your client reports her appetite has increased. She snacks throughout the day and has gained 15 pounds in the past 3 months. Your client reports she used to create jewelry for fun and to supplement her income. However, she stopped making craft jewelry and closed her online shop about 4 months ago because of fatigue and an inability to concentrate. So far, we see impacts on the kids, her mom, and work. As you can see, there's a lot of lines on the screen already. So I don't encourage you to write these down every time you see them, but I want you to take a mental note of them because these are typically the things that the test is going to ask questions about. So now I've cleared the screen and we're going to read everything from the beginning as if we were taking the actual exam. Part 1, intake, client, age 35, gender, female, sexuality, heterosexual, ethnicity, white, relationship status, single, divorced, Counseling setting, agency, types of counseling, individual, provisional diagnosis, major depressive disorder, single episode, moderate with anxious distress, mild F32.1. Presenting problem. You're a licensed mental health counselor working in a private practice setting. During the initial counseling session, a 35-year-old divorced female, mother of 2 children aged 10 and 12, says she has come for services because I'm in a rut and cannot find a way out. I feel hopeless and I'm not sure what to do with my life. Your client says the feelings of hopelessness began 6 months ago, and the session with you is her first attempt at counseling. I want to feel as confident and happy as I was when I first met my ex-husband. I was working full-time as a caseworker and taking classes to be a nurse. She's currently unemployed, but previously worked from home doing billing for a major insurance carrier. The client appears tearful and expresses that she felt like a failure since moving back in with her mother a year ago. My kids are often in trouble at school, and it got to a point where I couldn't handle them on my own, so I had to ask my mom for help. Client reports feeling sad and anxious since her divorce from her husband 3 years ago. He left me for a younger woman. I don't know how I will make it without a spouse. She feels sad, empty, and lonely most days, disclosing, I wake up feeling sad. I can't remember the last time I enjoyed something. Your client reports her appetite has increased. She snacks throughout the day and has gained 15 pounds in the last 3 months. Your client reports that she used to create jewelry for fun and to supplement her income. However, she stopped making craft jewelry and closed her online shop about 4 months ago because of fatigue and an inability to concentrate. After dealing with the kids, I just want to eat and go to bed. Your client reports that for the past 6 months, she has been sleeping a couple of hours more than usual. She has asked her mother to watch her children 3 to 4 nights a week because she is so fatigued. I'm not able to spend as much time with the kids as I did in the past, and when I am with them, I tend to zone out and can't relax. I feel guilty. I've ruined their lives. Although she states she has no desire to commit suicide and has no plan to harm others, she does regularly think that everyone she knows would be better off without her. The only reason she is going to counseling is because her mother won't stop bugging her for staying in bed all day. Mental status exam. Your client presents with fair grooming and hygiene. Her hair is clean and brushed. She is dressed appropriately for the weather in a gray sweatshirt and pants. She is alert and oriented to person, place, and time. The client's flat affect is congruent with her sad and hopeless mood. The client's long-term memories are within a normal range. No abnormalities are noted in the client's motor movements or gait. Her eye contact is good. The client's thoughts are cogent and linear. The client has difficulty concentrating, and questions must be repeated several times during the interview. The client's thought content is focused primarily on a harsh self-judgment with an emphasis on recollections of past feelings. No delusions or hallucinations are noted. The client denies any thoughts of self-harm, including ideas or plans to commit suicide. The client has not experienced a manic or hypomanic episode and denies using alcohol or other substances. Psychosocial and family history. Your client has 1 sister, 2 years younger, who lives out of state. The client's parents are still married, though her father lives in another state. Your client shares that she never felt valued in her family. She feels hopeless around them because they question her ability to achieve anything worthwhile, including maintaining a job. She denies any physical or sexual abuse or other trauma. Your client reports experiencing significant financial difficulties since her divorce, which was another reason that she moved in with her mother, despite conflicts in the mother-daughter relationship. At the end of the intake, the client asks, will my mother have access to my records because she pays for counseling? You address the client's concern about confidentiality since her mother has agreed to subsidize her counseling. You schedule the next session. Now we are heading into the questions. I'm going to pop it up on another screen so that we can use our checklist at the same time. Here is our NCMHCE success framework, and we are going to go down to the table of contents to grab our checklist. And here is our lovely checklist. So this is what we'll be using as we are navigating the questions. Question 1. During the intake, how would you establish a therapeutic relationship with this client? So first thing I'm noticing is we've got some keywords here. We have the keyword during. Whenever we see first, next, during, those types of keywords, that means to think very literally. So the client is still sitting in front of us. We can go down to the before answering the question section and click during or within because we did catch that. How would you establish a therapeutic relationship with this client? We have A, challenge her irrational thoughts about her self-evaluations. B, advise her about how to manage painful experiences. C, summarize her emotional struggles and desire for change. Or D, for areas in which she could improve interpersonal relationships. Something else that we need to be keeping in mind is the session number. This was only the intake session. And typically for the first 4 sessions, when we're just focusing on rapport, we want to be thinking about psychoeducation, exploring questions, validating, normalizing, all just things that help us to get to know the client better. We want to be careful not to get too direct with the client and do things like confrontation or more direct interventions. So here in the before we start section, it says to note the session number. So we kept in mind that we are just in the intake session. So looking at A, challenging her rational thoughts, that would be way too soon because it is the first session. Typically, I like to say, wait until we're in session 5 to begin challenging or confronting. The next one says to advise her about how to manage her painful experiences. Again, it's a little too soon for that. We also don't really give advice as therapists. We give recommendations, but it's just the first session. We're just getting to know her. C, summarize her emotional struggles and desire for change. That could possibly be helpful. It shows that we're trying to get to know her and learn what's going on by us summarizing. D, explore areas in which she can improve interpersonal relationships. That one is possible because it's talking about exploring. So let's say that we've narrowed it down to these 2. Now let's take it a step further and look more closely. Which one of these fit best for when we've just met someone? Although D does say explore, the rest of the answer also says improve her interpersonal relationships. We just met this lady. So that would be something that would probably be more appropriate for later on after we have established a better rapport with her. So based off all of that, that leads us with our correct answer as likely being C. And that is the correct answer. C, summarize her emotional struggles and desire for change. Question 2, how would you manage the client's concern about confidentiality? Whenever we see questions that start with how, why, what should you, those kinds of things, I'm always thinking about session number because, like I mentioned previously, when it's earlier on, there's certain things that are more appropriate to do than later on in the session. So this one, really making sure to keep in mind that we're still in the intake session. We have A, explain you will share whether or not the client is making progress, but no details. B, use the informed consent process to discuss legal responsibilities and ethical guidelines. C, request the mother consent to treatment and obtain the client's consent. Or D, ask the client to include her mother in her treatment to address this concern. And this is an ethical question. So we need to keep in mind that the client is adult. And because of that, we do not have to share anything. In real life, we would give the pay your credit card authorization form and explain that this does not grant them access to treatment information. If the client were to fill out a release of information form, that would be the only way that the mother could get the specific details. So that would mean A is not accurate. We do not have to explain. We will share whether or not the client is making progress, but no details. B is potentially accurate. Use the informed consent process to discuss legal responsibilities and ethical guidelines. C is not accurate. We do not need to request the mother consent to treatment and obtain the client's consent. And D is not accurate. We do not need to ask the client to include her mother in treatment to address this concern, which leaves us with B. So we would just explain informed consent. We would explain our privacy policies, the legal responsibilities, and the ethical guidelines as mentioned here in the correct answer. Question 3, what self-report from the client meets one of the supporting criteria for the diagnosis? The client currently has major depressive disorder, single episode, moderate with anxious distress, mild F32.1. With that in mind, when it comes to diagnoses, glancing at our checklist again, we'll go to the content check, and there is that box. Do the symptoms match the diagnosis? So let's read through our answers and see. We have A, the client's difficulty with her children, Possibly, kind of vague though, could apply to other things. E, the client's job loss. The narrative hasn't told us yet why the client lost their job, so we want to be careful not to make assumptions. C, the client's inability to manage children. Again, that isn't specifically related to depression. That could apply to a lot of other situations. Or D, the client's difficulty concentrating. That is one of the symptoms of depression. And out of all of the options here, that is the best fit. So really, really be careful not to read into the narrative or make assumptions about anything. We can only go off of the information that has been presented to us so far. Question 4. What criteria were used to determine the severity specifier for the client's major depressive disorder? So again, going back to the diagnosis, and this diagnosis does have a specifier. And for this specifier, it includes single episode, moderate with anxious distress, and mild. So those are things we need to keep in mind. And that's part of why we like to look at the measurable pieces, because that gives us some insight into severity, like we see in this question. So we have A, number of symptoms is not substantially in excess of those needed to make the diagnosis. Yet functional impairment exists, possibly. The intensity of the symptoms is distressing, but manageable and result in minor impairment of social or occupational functioning. But I would say it is more than minor at this point. So I'm going to go ahead and rule that one out. The intensity of symptoms is high and is accompanied by psychomotor agitation and mixed features associated with major depressive disorder. I don't think it said anything about psychomotor agitation. And with long answers like the ones we see here, we have to be careful that the full statement fits, because if there's part of it that throws it off, it's not the one to go with. And then D, the number of symptoms and their intensity is distressing and unmanageable and interfere with clients' social and occupational functioning. So it is intense and distressing, function moderately at least, because it did mention that she has her mom watch the kids 3 to 4 days of the week. Well, that's about half of the week. So it's not completely unmanageable. This answer might be a little too intense for where the client is currently at. So going back to A, number of symptoms is not substantially in excess. It's about halfway, given that her severity is currently moderate. That fits, yet she is still being impacted functionally. Question 5. What long-term goal would guide treatment of the client's presenting problem? So as referenced in the guide, long-term refers to something that would realistically take 30 days or more to accomplish. Short-term refers to things that would realistically take 30 days or less to accomplish. Long-term goals also tend to be more permanent sounding with their keywords. So things like return to certain levels would be considered long-term. Short-term keywords are typically more incremental. Decrease might seem short-term, but this one also says 6 weeks. So that could potentially be longer term, which is why it's important to read the whole answer. So spend 1 hour each day focusing on what is going right. That could possibly happen in 30 days or less. So we're going to rule that one out. B, return to premarital levels for better for self-confidence and autonomy. C, decrease negative thoughts and feelings by half in 6 weeks, possibly long term. So we'll leave that one. And then get out of bed before 8 a.m. each morning could potentially be short term. So that leaves us with 2. So the second part of this question to pay attention to is the presenting problem. And on our checklist, we have a spot that says to check, is it a 2-part question? Or is it a multi-part question? And in this case, it is. So we'll check off that one. So they're referring to a presenting problem. Hopefully you do remember the presenting problem, but if not, because we've ruled it down to 2, now I would say go back and double check what the presenting problem was. And for her, she said, I want to feel as confident and happy as I was when I first met my ex-husband, which directly fits B, return to premarital levels or better for self-confidence and autonomy. Okay, part 2. So now that we've moved on to the following section, we're still looking for what's measurable, symptoms and behaviors, who or what else is being impacted. And we are also looking to see what's changed from the previous section to the current one and paying attention to the session number. First session. 3 weeks after the intake session. Your client arrives at the session on time. The client reports, I feel about the same. Not much has changed for me. The client shares that she applied for open job positions but has not performed well in interviews because she's feeling so hopeless. She was turned down for 3 jobs for which she interviewed. Your client states, I must be a failure. I will probably never get a job. And me and my kids will end up living on the street. In addition, she feels anxious and overwhelmed when she thinks about how she will take care of her kids financially in the future and states, I worry a lot about paying the bills and feel like I will never have enough money again to live on my own. You provide empathy and educate the client on the tenets of cognitive behavioral therapy, CBT, to challenge her thoughts and manage her feelings. In order to facilitate her understanding of CBT, ask the client to keep a journal of her thoughts and feelings. Question 6. From a CBT perspective, how would you help your client reduce her feelings of anxiety? So with this one, they are asking about a specific theory. As I mentioned in our theories video, when we're looking at theories, there's 5 things we want to keep in mind. We want to know who the founder is, the main idea, how the techniques are utilized, what the therapist looks like in practice with the client, and when we should and should not use that theory. This one focuses on what the therapist looks like with the client. So with CBT, it is a much more direct approach. We're not afraid to confront the client, challenge them, and reframe what's going on for them. So keep that in mind with these answer choices. We have A, reflect and summarize her feelings accurately. B, challenge your client's ability to predict future outcomes. C, determine how she managed feelings about the future as a child. Or D, explore your client's payoff for feeling anxious and overwhelmed. A would better fit person-centered. That's a much more hands-off approach from the therapist and is a little bit more passive. B talks about challenging, and it's talking about the client's thoughts, so that could potentially fit CBT. C is a better fit for Adlerian with the focus on the childhood memories, feelings, recollections, those things. D, I'm not sure it goes with a specific theory, and it also isn't really specific enough for CBT. So that leaves us with B seeming like the best fit. 7. What cognitive error did the client make when disclosing not being hired for 3 jobs for which she interviewed? A, all or nothing thinking. B, personalizing. C, catastrophizing. Or D, minimizing. So all of these are thinking errors. So this one's about knowing the actual definition for these. So with this one, she had said, I must be a failure. I will never get a job. And me and my kids will end up living on the street. So that seems to be quite a jump to worst case scenario, very exaggerated in the worst ways. And so because it is so extreme, that would best fit catastrophize. All or nothing could have been a good option, but because of the intensity of what she's believing to be happening, catastrophizing is just a little bit of a better fit. Question 8. What information from the case study would you explore to help the client remember her strength? A, reminding the client of the disclosure she made about her previous level of functioning. B, ask the client to recall how she responded to job interviews. C, explore the client's feelings of gratitude for her mother paying for counseling. Or D, praise the client for her ability to recognize cognitive errors in the session. So this question is wanting us to focus on her strengths. So which one would remind her of that? Reminding her about the disclosure she made about her previous level of functioning. So sometimes I find it helpful to reword the answer choices when they seem too wordy or clinical for me. So this is basically saying, just remind her about all the good things she told you about before. B, ask the client to recall how she responded to interviews. She did not respond well, so that might make her feel worse than better. For the client's feelings of gratitude for her mother paying for counseling doesn't really answer this question. That's focusing on somebody else's strengths and can make her feel worse as well. Or D, praise the client for her ability to recognize cognitive errors in the session. That didn't happen. She wasn't able to tell yet that she was engaging in cognitive errors. That would make A, remind the client of the disclosure she made about her previous level of functioning the best answer. Question 9. What non-judgmental response would you make after the client's disclosure about not being selected for the jobs? A, I'm sorry they didn't hire you and wonder what went wrong in the interview. B, you feel upset about this experience, but you will learn from this situation. C, we all experience this kind of rejection even when we're overqualified. Or D, it sounds like the prospect of living with homelessness would be really scary for you. So A doesn't fit because of this last half. What went wrong? That's kind of judgy. Same for the second one. The last half isn't great here. You'll learn from from the situation. C, we've all experienced this kind of rejection, even when we're overqualified, possibly. Or D, it sounds like the prospect of living with homelessness would be really scary for you. Okay, so from here, I would then go back and look to see what she focused on when she was sharing about her not getting selected. I don't see anything about her saying she was overqualified. If anything, she's focusing more on her inability or her faults because she mentions, I must be a failure. I'll never get a job. And she focuses a lot on the what ifs or what could possibly happen because of this. It doesn't say, or at least I'm not seeing her griping about how she has so mixed experience and they should have picked her for it. If anything, it kind of does says that she didn't perform well in the interviews. So based off of that, out of the two that we have narrowed it down to, D seems more relevant to what was actually said in the narrative. Now we're heading into part 3. I will say on the real test, some of these sessions get really long and have way more paragraphs of stuff than just what's on the sample here. I like to use countingexam.com when I'm doing narratives with my clients. It has a variety of short ones and long ones too. Keep in mind that because of copyright, they can't make it look exactly like the test, but it is a really great resource. Part 3, second session, 6 weeks after the intake session. The client appears to be at a healthier weight, and it appears as though her posture has improved a bit. She says she has cut down on eating her feelings and is paying more attention to when she feels hungry. You praise her for this behavioral change. The client smiles at the affirmation and says, yes, it hasn't been easy. I am feeling more comfortable in my clothes, but I have a long way to go. I'm still a whale. The client reports that she's been keeping her journal and has recognized patterns between her experiences and her feelings of hopelessness. She reports that she feels the most hopeless when she sees couples with their children. I see that perfect little family and how great they are doing, and I start crying. I don't think I will find another spouse, and not having a father around is hurting my kids. I am so upset about this that I can't sleep some nights. You validate the client's experience and work to build trust. You discuss cognitive distortions and examine cognitive errors the client has made during the session and the impact those errors have had on her emotion. Question 10. What counting skill would you use to empathetically validate the client's experience with how her relationship with food influences her behaviors and emotions? A. Reflect the client's feelings about her weight loss. B. Assess the logic of the client's claim that she is a whale. C. Reframe the client's statement to remind her she is capable of change. Or D. Challenge the meaning of the client's statement about her weight loss. So here in the question, they're wanting us to validate the client's experience with her food in regards to her behaviors and emotions. So from looking at the answer choices, I would already rule out B. That would be more challenging than it would be validating. Same for D. This one actually says it in the answer choice to challenge it. Although those are helpful, they don't necessarily answer the question. And then reframing would be getting her to look at it from a different angle, which again is helpful, but doesn't answer the question. And like our checklist says, we want to make sure it answers all parts of the question. And so because of that, that leaves us with A as likely the best answer. Empathy and validating, we're typically just letting the client know that we hear them. 11, after validating the client's feelings about her weight, what cognitive error would you bring to her attention based on her statement? A, selective abstraction. B, all or nothing thinking. C, minimizing. D, catastrophizing. Again, this is related to CBT or theories. So on our content checklist, we need to check off, do I recognize the theory/intervention being used? So with A, selective abstraction, not necessarily like hyper focusing on one concept. So that wouldn't really fit. All or nothing thinking, also black and white thinking. She's not saying like she'll never be able to find it or never be able to help. She says that she doesn't think. So it's not necessarily completely all or nothing. Minimizing could be possible because she did minimize her weight loss and the fact that she's feeling better and instead focused on what she doesn't have. She said, I'm feeling more comfortable, but I have a long way to go. And she says, I see that perfect little family and how great they're doing. So she doesn't really sit very long with the positive that she's been experiencing, possible. And then catastrophizing. So when we look at the changes from the previous session to the current one, it's much less doom or gloom than what we saw previously. She's not doing that, like, we're going to be homeless for forever, never get anywhere good. She's still very hopeless and negative, but it's significantly less intense, so it's no longer catastrophizing. That leaves us with minimizing as the correct answer. Question 12. From a CBT perspective, what question would you ask to challenge the logic of the client's belief about her behavior being detrimental to her children? Again, another CBT question, so really making sure you know your theory, especially CBT, because this test seems to love their CBT questions. A, how would your children describe their life living with their grandmother? B, what will your life look like if you find a new husband and remarry? C, what other steps have you taken to improve your situation? Or D, how did you come to the conclusion that your children are being hurt? Okay, so for this one, it's CBT, and we're challenging the logic of her thoughts or beliefs. So A, how would your children describe their life living with their grandmother? Helpful, but isn't actually directly challenging anything. B, what will your life look like if you find a new husband and remarry? Again, isn't challenging the belief that directly enough. C, what other steps have you taken to improve your situation? Kind of avoids the belief altogether. And then D, how did you come to the conclusion that your children are being hurt? Here is where we are directly addressing the thought or the belief that was referenced in the question. So heading to our checklist and clicking, did I answer all parts of the question? We did now. And so it seems like D is our best bet. And that is correct. Considering your client's statement in both sessions after the intake session about worry and stress, what potential comorbid disorder warrants further assessment? That one was wordy. So basically, with comorbid, they're asking about an additional diagnosis based on what we've seen in the previous sessions. And so that is where we would head to our checklist and we would be able to say that we are able to figure out what the question is actually asking. So we have A, separation anxiety, B, prolonged grief disorder, C, panic disorder, or D, generalized anxiety. So with the separation anxiety, she's not necessarily worried about losing her husband because he is already gone. They're already separated. And separation anxiety is more of the fear of someone leaving or losing that person. For prolonged grief disorder, that's in specific relation to the death of a person. So that doesn't apply in this situation. Panic disorder, she hasn't had a panic attack and is now worried about having more. So that wouldn't apply to her. But generalized anxiety disorder, that could fit. We did see in the beginning that she had that specifier of anxious distress. But as we see in the narrative, her anxiety is much more intense than it may have originally seemed, and it applies to a variety of situations. So generalized anxiety could be considered as a potential comorbid diagnosis, but we would need to find out more first, which fits what this question is asking because it just says potential and warrants further assessment. So there you have it. We've done a full narrative together. And when I'm reading a narrative, I still read the whole story. I'm just reading intentionally and working to focus on key things. Let me tell you, when you know what to focus on, it makes this test a lot easier. It's still a hard test, but it is a lot easier to navigate. And if the narratives are where you struggle on this test more than the actual content, I'll link my narrative success framework guide in the description so that you can get your own copy too. It walks you through the key things to look for, why some of these common mistakes keep happening, and it gives you a checklist at the end so that you can use whenever you're reviewing your answers and trying to figure out where you went wrong. And if you haven't seen my other videos, make sure to go check those out because those will be helpful too. I hope this helped make the narratives feel more manageable. Let me know in the comments if there is a certain tip or question that you still don't really understand, and I will see you in our next video.